All right, good morning. Just wanted to give you some updates on the past 24 hours of stuff happening in the city related to COVID-19. The big announcement yesterday was the announcement of the One Sioux Falls Fund that we established to help local residents who have been impacted and will be impacted by COVID-19. The important thing, even though it's called the One Sioux Falls Fund, this is going to be for our MSA. Anyone impacted in the Sioux Falls MSA, which again is Minnehaha, Lincoln, McCook, and Turner counties. And specifically, it's going to be heavily geared toward people facing evictions, housing needs, and financial hardships related to COVID. So that's an important thing for me right now, is keeping people in their housing. And so we're standing up a process today on how people will be able to apply and a distribution mechanism for those funds. We set up with the Sioux Falls Area Community Foundation. We got a lead gift from First Premier Bank card on that, and just got an email about 2 minutes ago from the foundation. We're at about $820,000 in that account already. So the business community has stepped up incredibly for that. So I really want to just say thank you to the business community, our banking community, who is stepping up to help with that. If you have questions on that or want to learn more, go to the Helpline Center, helplincenter.org, which again, the Helpline Center is playing a pretty critical role for us once again in this pandemic response, as they've done in other responses for the city in the past with that. So you can go online there. Some people have asked about transit. Our transit continues to run. We've implemented some enhanced sanitary protocols on transit, so transit is still available. I was just told that ride-sharing services are shut down nationwide, so the Lyfts and Ubers of the world are not available. Our transit is available, and we've blocked certain seats to encourage social distancing and so forth. So please feel free to use our public transit system. One key right now, a key message for me, is the need for people to help their neighbor. And what do I mean by that? With the announcement that schools are going to be closed for another week, it's starting to put people in some very difficult situations with balancing employment and childcare. And some daycares are closed, and what are people going to do with those childcare needs? And so if you have a friend, a neighbor, someone that you know is going to be impacted by this, please put your hand up and help them. Offer to watch their child so that they can work. Offer to bring them a meal. Offer to do something that will relieve the tension and the burden that they're feeling right now. Because as much as I want to say there's a single government program we can create that's going to help everybody, we're going to have to rely on the collective goodwill of the community to really have neighbors help neighbors in this. I talked about it a little bit yesterday, but it's come up again today. A conversation I just had with the governor about an hour and a half ago, is small businesses and the toll we're already seeing on small business just in the 8 days since we've really been dealing with this issue. Can't stress enough the importance to take advantage of any small business opportunities you can right now and support small business. Yesterday in Sioux Falls, for instance, a small thing that we're able to do, but we block off certain parking in our downtown area to allow for kind of grab and go spots where people can go and pick up and do takeout from our businesses that are remaining open. Consistent with what the governor has said, we do not have any intention of creating a mandated closure of bars and restaurants and fitness studios. Not only do we not have a plan to do that, I don't have the authority to do that. And I hope you can take some comfort in the fact that we are a nation of laws and a country of laws, and the mayor has so many tools that he can utilize in situations like this. I'm not in a position where I can mandate the closure of businesses. What I am asking, though, and heavily recommending, is that businesses follow the 10 and under social gathering guidelines very religiously. So that may mean altering your business model in some way. That may be policing the crowds that are in your business, and I say crowds If you're a coffee shop, you're going to have to maybe rearrange your setup so that tables aren't near each other. You maybe saw how we set up our Carnegie Town Hall last night for a city council meeting. We're not going to mandate the closure of those businesses, but man, am I relying heavy on them to take this seriously and to regulate their businesses, self-regulate them accordingly. You know, the last thing I'll say before I'll turn it over to Jill is I want everyone to just ensure that there's a spirit of calm in our response here. There is a tremendous amount of hysteria that is out there on this topic right now. And I think people at sometimes want your leaders to respond with some of that same level of hysteria. And if we aren't taking it seriously enough. I'm here to tell you that on the other side of this wall is an incredible number of professionals that are taking this incredibly seriously. But our goal is to instill a sense of calm, to avoid hysteria, to provide rational responses that put public safety first, public health first. That's our number one priority in this. So tonight at 7 p.m., you can join me on my Facebook page. I'm getting a lot of questions from individuals that they want answered. I know the media, you have your own questions. A lot of individuals just having questions that they want to answer. We're going to do that at 7 o'clock tonight. And I'm trying to stay in touch with the public through that channel. That's been working well as well. So I appreciate the great coverage from our media outlets on this. You guys are very critical in getting the correct information out to people and relaying on information in a timely fashion. Thank you for doing that. And with that, I'm going to turn it over to Jill Franken, our Public Health Director, with some updates on what we saw yesterday and what we expect today. And I will be available too at the end if there are questions. Thank you.
Hello, Jill Franken, Public Health Director with the City of Sioux Falls. To update you all, yesterday the State Department of Health did confirm one new case of COVID-19. That brings the state's total cases to 11. This new case was identified in Minnehaha County, which brings Minnehaha County's case count to 5. This newest identified case, was really proactive, taking steps to self-isolate and avoid contact with others. And so we're really grateful for that proactive action that this person took and all that are taking that proactive action to follow what the State Department of Health is indicating they should be doing if they test positive, as well as I want to say for anybody who is found to be a contact and has been in contact with the State Department of Health because they have been in contact with someone who's positive for COVID, following those instructions and doing everything that they say to either isolate or quarantine is incredibly important right now. The South Dakota Department of Health has been continuing to push out recommendations and guidances, and I want to remind everybody that the guidance is also on the City of Sioux Falls website. I want to make sure that I mentioned that trusted sources of information are really, really important right now. We continue to talk about ways that we can put out that trusted information, and so we'll continue to be providing that, as well as the State Department of Health's website and the cdc.gov website. I also want to mention that yesterday the Board of Health recommended that the city adopt a resolution to limit gatherings of 10 people. The mayor alluded to this as far as, how to assure that we are all complying with that recommendation of limiting social gatherings of 10 or fewer people. Last night, the Board of Health took regulation action, and it was adopted by the City Council for our city-owned venues, that we would also take that action as ordinance and limit to 10 people or less in city-owned and managed facilities. And so that's information that will continue to be put out there, and right now we'll continue that until we receive additional guidance from the federal government and from the State Department of Health. So with that, I'll turn it over. We've got The mayor alluded to this, that we have an incredible number of people that are working very diligently on this effort for the community. And a couple of those entities are both Avera and Sanford. And so I think it's important for them to be able to share some information with you today as well. And so first off is Dr. Mike Elliott. He's Chief Medical Officer with Avera McKinnon.
Hello, everybody. My name is Dr. Mike Elliott. I am the Chief Medical Officer at Avera McKinnon Hospital. Avera, as you might imagine, is doing a tremendous amount of work to prepare for this. Want to share with you a couple of key points. We are encouraging all folks that receive their health care from an Avera facility to call before they come into a clinic or other point of health care. The reason for this is so that we can be best prepared to care for you, and we don't risk unnecessary exposure to our physicians and staff that would then potentially keep them out of work for a couple of weeks. If you have been tested for COVID-19, please realize that the test results may take several days to come back. This is not unsurprising, and please try to be patient with all of us doing the testing. If you are sick and you are waiting for testing, please stay home. Please practice the social isolation practices that we have been imploring of the public for days now. If you are sick and you're at home, rest, plenty of fluids, take good care of yourself, monitor your symptoms. I know that might sound very basic, but the basic things here will make a difference. Encourage you to, again, rest, drink, and take good care of yourself. It's important for all of us to understand that COVID-19 symptoms can vary dramatically from patient to patient. There are some patients, some people that will have COVID-19 and will be very mildly symptomatic. And then, of course, there are those that can be severely affected by this. If you know that you're at an at-risk population, you're elderly, you have a chronic lung problem, an immune problem, that you should be taking extra precautions to avoid crowds and socially isolate yourself during this pandemic. Just to remind you, typical symptoms of COVID-19 are the onset in the last 14 days of a fever greater than 100, a cough, or shortness of breath. Anyone who's experiencing difficulty breathing or has an extremely high temperature should first call their healthcare provider or facility. Let them know what's going on, and we can arrange for appropriate care for you. I also want everyone to be assured that we, Avera, are proud to work in close collaboration with the city, with the South Dakota Department of Health, with our partners at Sanford, to best plan for how we can take care of folks in our areas, in this region. No matter what comes, we are working diligently to be prepared for it. With that, I'm going to turn it over to my colleague from Sanford, Dr. Mike Wildy.
Thank you, Dr. Elliott. And I'm Dr. Mike Wildy. I'm a medical officer at Sanford in Sioux Falls. Dr. Elliott's message made some excellent points and simply would affirm that we have agreement and have worked very closely with Avera along with city officials, state and federal, in response to this outbreak. One thing that has come to our attention is there's a need in the community for blood. There have been, due to school stoppages, due to lack of public gatherings, the blood banks have not been able to get out to get donations in those usual settings. And I know they are doing some alternative donations, and would strongly encourage people, if you're healthy, if you're not in that at-risk population and want to stay out of social gatherings, to consider giving of yourself. This region traditionally has a culture of giving, and now would be the time to consider that. Both organizations continue to see patients outside of this illness in need of health care, and blood donation is imperative at this time. The other thing I want to hit on is really what we're learning across the world and in the nation in areas that are more affected by COVID-19. And it also points out the need for the flattening of the curve and our ability as a health system to respond to the public need. What we're seeing is that about 80% of patients affected by this illness will have a common cold type symptoms, as Dr. Elliott alluded to. And in that setting, the need to isolate and not transmit that is imperative. Of those 80%, or excuse me, of those affected, 10% will need hospitalization. 5% will need intensive care unit care. And those 5% do tend to come from the population of over the 60 years old and or chronic medical conditions such as lung, heart illness in addition to diabetes. Those are really the population that they'll be in the hospital on average for 10 days. And as you do the math, for example, if we were to have 1,000 ill patients in a community, based on the statistics I just shared and what they learned in China, was that about 100 of those patients will need hospitalization, about 50 in an intensive care unit setting. As that occurs, and as that occurs on a daily basis with a 10-day hospitalization, you can see how the math rather exponentially goes up and can lead to issues within a health system and the ability to respond, even with national resources, and it can occur nationally. Therefore, the need to flatten that curve. We are ready to respond as an organization to a steady influx of patients. It's going to be difficult to work within a surge of patients. And so really that need to flatten that curve, and that's where everyone in this community can help. People are coming forward in the generosity of this community, as they always respond, coming forward asking, what can I do? And that's wonderful. Blood donation is one of those areas. The other area is really taking that message of isolation in this moment, especially take it upon yourself if you have a chronic illness, if you're over the age of 60, to really focus on staying at home, using the hand hygiene, keeping your hands away from your face. If you're not in that age group, if you're ill, stay home, because you're the population that can spread that to those in need. That can lead to a sharpening of that curve. And so really want to reiterate that message. I represent a healthcare system that's ready. We've done tremendous work. We've worked with our community to be ready, but we need your help as well, and thank you. With that, I'd like to turn it back over to Jill Franken. So the question, I'll reiterate it, please correct me if I miss it, but the question is the response regarding testing and the shortage of testing and the impact that may have. Really testing, as myself and Dr. Elliott have conversed on, and we all know, is the impact of testing is, for your care in regard to testing, is conservation of the personal protective equipment. If we know you do not have this illness, we may not have to utilize those resources. Also in regard to where we have patients in our hospital. Beyond that, the testing is not important for the care because, as I alluded to with that 10-day hospitalization, this is a viral illness. We have some medications that treat viruses. We do not yet have one for this. They are in testing. And so to know that you have the illness or not outside of utilization of some resources is really not that important for your care. And it really continues to drive home that message of we're going to take care of you if you're in need. If not, Certainly isolate yourself if you're ill or at an at-risk population. I turn it over to Dr. Elliott if he has anything to add to that.
Yeah, thanks, Dr. Wildy. You know, it's a great question. How does a lack of testing, how does a lag time in getting test results back affect us? And Dr. Wildy's point that it affects maybe some of the operations within the healthcare system, but for you as a patient, if you're sick right now, stay home, isolate yourselves, period, end of story. Whether you've got the common cold or you've got COVID-19, stay home, isolate yourselves, try to reduce the spread of this. If you are ill enough to require a hospitalization, we are going to treat your symptoms. There is no specific treatment for COVID-19, so we will treat your symptoms regardless of your diagnosis. We still have the ability to test for influenza, so if you test positive for influenza, then yes, there are some medications we can provide for that, but otherwise it is symptomatic support for you, somewhat irregardless of whether you've got COVID-19 or not.
And that still applies even though the state...
So the question was, does Dr. Wildy's prior statement and mine still hold given the recent announcement from the State Department of Health? Absolutely, yes, it does. We are going to continue to treat patients based on their symptoms and encourage people to self-isolate based on their symptoms, regardless of what the specific diagnosis is.
Are medical professionals also being checked along the way, not necessarily for this, but just to make sure their temperatures are staying even keel?
Yes, they are, depending on a lot of factors, including potential exposure, the type of personal protective equipment that they were able to wear before that exposure, travel history, lots of different factors go into our regular screening of our staff.
So is South Dakota plan on getting?
So the question of the supply, is there a shortage of supplies to do the testing and are hospitals being affected by it? We have folks in our supply chain that are working diligently to do everything possible to ensure that we don't run short of the swabs that we would use to test patients or the viral medium required to take that swab and get it to a lab for testing. Is there a possibility of a shortage? Absolutely. Right now, I can speak for Avera. Dr. Wildy, I'm assuming Sanford is flush on them at this point as well. We're okay at this point.
And what about respirators?
The question is, what about respirators? You're thinking ventilators?
Yeah, they said respirators. Ventilators, how's the stock on that? Does that remain high?
You know, that's a relative question. It depends on how many patients we have. Right now, we certainly have enough, and the state has a stockpile of ventilators, so there's discussion with the state level on can we get some of that stockpile. Of course, the answer is going to be yes. We're coordinating the efforts with the state. As of right now, we are just fine there.
I get it. I can add to it. Thanks, Dr. Elliott. And adding on to that respirator question as well, we do have ample supply. However, it really speaks to the flattening of the curve. You get too many at one time, that on a 10-day stay, that's going to overload anyone. On a flat trajectory, we're fine. The good news this year in regard to really a lot of our supplies is, of course, we anticipate influenza on an annual basis, and we have tremendous supplies at Sanford. influenza this year, while prevalent, was mostly an outpatient-treated illness, therefore leaving us with pretty good stocks of supplies from that standpoint. But we are working closely with our supply chain team to monitor literally hour by hour where we're at and looking at community spread, which we really need in a flat manner. So the question is the capacity of Sioux Falls hospitals, looking at trajectories, and I'll just put my own opinion in there. What we're learning from other international and national outbreaks. And yeah, that's really been the great relationship between ourselves, Avera, and even other resources within this community to look at our response and what we have available and what can be moved. Also working with our outside of Sioux Falls facilities and what can be moved in a moment's notice and how that can be accomplished. The question was around testing locally and anticipating any delays in that. We are progressing toward that, working closely with Avera, as was announced with the governor yesterday, and we don't anticipate any delays. We certainly anticipate with the situation as it is right now, there will be challenges that come forward, but we are always ready to address those and working very hard on getting that testing as rapidly as possible. So the question was around really the statistics I pointed out and the 10% and the 5%. And I was hoping not to get into specific math, but that's fine. It's a good question. And please understand, for those that are fact checking me, these are my roundings based on decimal points, et cetera, out there really to drive the point home. So as I understand it, based on the evidence out of China, it's 10% require hospitalization. Of those 10% requiring hospitalization, 5% will need ICU care or intensive care unit care. So the question is around the methodology of the testing at each organization. I'll of course speak for Sanford. So the test is collected very similar, and in fact similar to an influenza test. There's a nasal swab, which is then placed in a liquid, which we have worked both with the state and with a private vendor to have that sample shipped either to the state or to the private vendor's lab to then be run. It is then run, as Dr. Elliott alluded to, with a turnaround time, which is at minimum 24 hours, which then positive results are run through the state and reported to the state. Negative results are given to the patient in as timely a manner as possible.